Okay, so now we're going to start by cleaning everything up. I'm going to put all my surgical instruments here over by the sink. I want to make sure that I remove all of my gauze from the pack. And any needles or sharps need to be removed. That should be the first thing that you always do. So just removing any needles or any sharps that we see in here. So we will remove this first. Putting this in the garbage. Sterile gloves can go in the garbage that Dr. White used. We want to remove, pull up and away from us. We should be able to pull up and away from us for this. Oops, just went into the sink there, that's fine. We need to remove this now. I'm going to walk with it down and away from everyone and into the sharps. Keep all the instruments here together so that I'm ready to use MetroClean on them in a little bit here. I'm going to clean up all of these things. Everything here can go into the garbage. Patients doing okay?
Patient's fine.
Make sure you're always checking on your patient. That should always be your priority. These bowls can go into this. They should be cleaned. They should be cleaned in the same sink as we're lifting our instruments. I did cut her nails too, so I can put these back in here. Put my scrub solution away. I'll have our scrub solution sit up here. Marking can you put back here? It just goes where it says marking there. Our alcohol can go away. Clippers. They're going to need to be cleaned up here. Clean them. Use a little bit of spray on them. Want to make sure that they're ready for when the next person grabs them. Sizing them out, making sure that you clean in between the teeth. The same thing on this side here. Those are going to be much cleaner for us now. And they can go back. They should go back on the charging stand. Like so. We did pre-anesthetic blood work. So I'm just going to put my blood sugar back. Everything was good. There was no concerns there. A little bit of flesh that I had for her. Still checking on her patient. Making sure that her vitals are stable, which they are. Then we can put this over this side here. And then I can pick up the drape and just take it off and set it aside for laundry. Then we need to wait for her to wake up in order for us to be taking the catheter out, but at this time we can be cleaning up the incision site. So for that, I'm just going to grab some peroxide. A little bit of peroxide here on the gauze. I'm just going to gently dab and remove the blood from the area there. I'm just going to apply some pressure because it's still bleeding a little bit there. It's not a bad idea to still apply a little bit of pressure and try and clean up your site here. Starting to wake up a little bit, we've got a palpebral response. If you take a look there, the incision looks fairly clean. We just have 4 sutures in there. We're going to let the owner know that they need to remove, bring the dog in to remove the sutures in about 10 to 14 days. We're probably going to aim for somewhere in the middle, around 12. So I'll tell the owner today that they need to book that appointment. And then we will give post-op meds in a second here.